I'm Dr. Solberg. I'm a family physician. I've been in practice for about 40 years now, and I've also mixed that practice with research, some of it involving advanced imaging, and I've had the opportunity to work with Dr. Rebecca Smith-Bindman now for about 5 years, I think, and she's a national expert in imaging, particularly around dosage and radiation. So Rebecca, I'm delighted that we're able to have this conversation today. As I talk with patients over the years, increasingly those conversations and those diagnostic workups involve advanced imaging, and I find that patients are not really aware of any downside. They're mostly looking for answers. So I'm wondering if you could help patients to get a better understanding of what some of the pros and cons are for using advanced imaging tests.
Absolutely. I think that the images that we get are phenomenally beautiful, and I think we've really been so excited by those images and the improving technology that we haven't really focused on, well, actually, what are we learning and what are the potential harms? The potential benefit is that you make the diagnosis, an accurate diagnosis, quickly and relatively easily. That's sort of the benefit. The harm side is a longer list and includes things, first, false positives. That you see something that you wish you hadn't seen, but you don't know what it is. And to be sure that it's nothing takes a long time. So I think that's one big category. There's another category of harm, which, as you mentioned, is really an area that I focus a lot of my research, is radiation exposure. It comes with X-rays, it comes with nuclear medicine tests, and it comes with CT scanning. And the radiation exposure can hurt the cells. It's basically enough energy that has the power to break DNA bonds and damage cells. And over a long period of time, that can really lead to further complications. The most important one is actually getting cancer from the radiation. And the risk is relatively small, but it's not trivial. And we actually get exposed to radiation all around us. You can't eliminate radiation. We get radiation from the sun. Radiation comes out of the earth. Radon. It's even in some of the foods that we eat in really small amounts. So we know that we get radiation a lot. We get radiation from going up in an airplane. We get radiation from being in, going through an airport scanner that uses a backscatter radiation technique. Those sources of radiation are really pretty low. Maybe a slightly higher amount of radiation comes from the X-rays that you get at dental X-rays. So the magnitude of the exposure from the CT scan is much, much higher. If you really need an imaging test, in general, the radiation is a relatively small issue, even of a CT scan. But if you don't need the imaging test, then the radiation is not so small. And it's worth thinking about whether or not you could avoid that. If it's really not going to help you, there is absolute harm. Again, not a huge amount of harm, but real harm that it's good to avoid if possible.
Well, practically everything that I recommend to my patients has both risks and benefits, and so imaging is not that different from those other kinds of conversations. I've always tried to make them feel like they have a role in the decision, and if they're going to do that, two things have to happen. One is that I have to explain what the reasons are for doing this, the potential benefits as well as the potential downsides. And the other thing is I need to know that patient well enough that I can understand their preferences, and I can try to address those preferences in that conversation. I think the biggest problem and the thing that's hardest for patients to understand is the fact that these tests are so good that they pick up a lot of things that we'd frankly rather not know about. And that may lead to not only additional testing, but perhaps interventions and treatments that could be harmful to them.
So there's a big movement in medicine, mostly focused on physicians and healthcare providers, but they're also trying to reach patients, called Choosing Wisely. That's focused on helping patients and doctors do appropriate imaging and do less inappropriate imaging. It's hard to know if that test is appropriate or not. What questions should the patient ask to know if they really need to get that test?
Well, I think it's difficult for most patients to ask questions that appear to be questioning their doctor's judgment. I'd suggest that if they're uncomfortable with doing that directly, that they ask it in a way that's more neutral, that say something like, I know that all tests have both benefits and harms. Can you tell me a little bit more about what the benefits and harms are from this particular test? What are you expecting to learn from it? And more importantly for me, how will it help to solve the problem that I brought to you in the first place?
You want to ask, why are you getting this test? What do you expect to learn from this test? So that would be one question. Is there a test that I could get that might give the same information, but that doesn't use radiation? So CT scans use radiation, MRIs, ultrasounds don't use radiation. And so could I get the same information from an ultrasound rather than a CT? And often a patient asking is all the motivation that's needed for the doctor to say, oh, that might work, let's try the ultrasound. So do I need a test? Do I need this test, or can I do a test that doesn't need radiation? I think a really good question to ask is, do I need that test now? So maybe I need the test, and maybe I need this test, but do I need it now, or can I wait? Can I push the tests further apart, and maybe that will allow me a test-free period?